Welcome to the Next Orbit podcast, where connecting healthcare's data is the next frontier. We take you inside conversations with policymakers, healthcare leaders, disruptors, and visionaries who are pushing boundaries in a system that resists change. This is your launchpad. Here is your host, Ben Wade.
Hi, welcome to another episode of the Next Orbit podcast. This week, the dust has finally settled on the 2026 ASTP Annual Meeting in DC. And if you were following the headlines, you know there was a big pivot towards deregulation, the growth in TEFCA participation, a new federal focus on making America healthy again through technology. And of course, there were plenty of discussions on AI. Rather than reading you the press releases, I wanted to get the perspective of the folks who were actually on the ground, navigating the hallways of the Omni Shoreham and sitting in those packed session rooms. Joining me today are my colleagues from Leap Orbit, our founding partner, David Finney. And if you're tuning in again, you've already met Mike Hunter. We're putting him on the other side of the table today. They've spent the last week distilling what these federal policy shifts actually mean for data interop, public health, and the providers we support every day. Welcome, gentlemen.
Thank you.
So, gentlemen, the big news from the meeting was the HTI-5 proposed rule and the shift towards a leaner, more, pro-innovation certification program. I believe they were proposing cutting 34 out of the 60 certification criteria, and I think amending seven others. Do you feel like this is a cutting of the red tape that will let us move faster, or are we losing important safety rails in the process?
It's always a trade-off. And I think one of the first things I'd note is that they're continuing to push forward with what has been at the heart of this all along, which is to get APIs in place that allow you to exchange data in a meaningful way and to enable the recipients of that data to use it in a meaningful way. So there's a big interest in, preventing information blocking and enabling the sharing of data. And I think that is going to lead to innovation. It is going to unlock the opportunity to do things. It also is reducing the requirement for providers and the vendors that support them to maintain requirements that have gotten old. So things like CCDAs and other things that are already well supported. They're no longer requiring that you certify you can do that. They want you to move to the newer, more modern ways of doing things. And so that is where they're focusing their attention. And I think that is going to be beneficial, that we are going to look towards a world where there is more innovation, potentially because of the focus on real world use cases and this API-based approach. That said, it's also true that as we look at this, there's going to be changes that could affect the ability to see what's going on, and you'll have to be more mindful of the fact that they aren't required to provide the same level of monitoring and logging and reporting anymore that they used to. Audit capabilities will be different, but if you're working on a project or on an initiative where that's required, I think then you would push that again, and that's something that we've certainly been mindful of and been doing in the projects that we work anyway here at Leap Orbit as a team, because we understand that. I don't know. That's kind of my high level take. I think, yes, it's going to cut some red tape. It's going to enable some innovation. We are going to need to be more mindful as we look at specific use cases around, are there needs for a level of visibility into some of the, back end processes that aren't currently going to be required anymore if this is fully adopted. I don't know. That's my
Mike,
take.
I'm sort of wondering if there'll be kind of a barbell effect to the winners and losers of this. I mean, I think for smaller, really agile companies like us, given the way that our SDLC process has already been accelerating in the last 6 to 9 months due to the way that AI is impacting how we engineer product, I think any barriers that get dropped to allow us to move quickly, to integrate with other systems and other sources of data, and really move fast and try new things will be beneficial. I also think this probably benefits the really, really big players because it kind of it makes it easier for them to set the terms of interoperability with other types of counterparts. So if I worry about anybody, it's the providers that are sort of in the middle market on the middle market products who, maybe their vendors are less inclined to make bigger investments in standards-based interoperability because they might feel like they don't have to for certification reasons, or maybe it makes it harder for those kind of middle market players to integrate on an equal playing field with some of the big dogs in the market. But we'll see. It's got to get through public comment and sort of the long grinder of rulemaking, and I guess we'll see what comes out the other end.
Yeah, that's a really good point, and I agree with that assessment. I think that you've clearly hit on something that's going to be important to keep track of as we go through the process of these changes. And also, I mean, to be honest, I think the fact that these were originally required, any system that's currently certified is probably going to maintain that at least for several development life cycles. And if they continue to see value, like that their customers appreciate it, that it gives them an advantage in the market, then they'll continue to maintain that. Regulation is just one way of getting it in there. If it turns out that, as a customer base, there just isn't a lot of support for that or a lot of requirement for it, I can see that would just naturally fall away at that point. And so part of it is, I think if you're thinking about this from that middle market provider, what is it that you currently have today? And are there things that you're concerned about? If you see like, hey, this is a capability that doesn't seem to be required anymore, it'd be a good idea to have a plan now and to start speaking to your vendor about that, to understand what their plans are and what their thinking is, so that you are able to make the best decision for you and your organization.
Yeah, I totally agree with you, Mike. I mean, I think if folks have strong feelings about the way that these proposed rules are going to impact transparency or patient privacy and security, I think that's what the rulemaking process is for, and public comment. And I'm sure HHS is going to get lots of input from the industry. So we'll see how they take that into account when they move to finalize the rule.
Gentlemen, on to the next topic, which will be on TEFCA. So the announcement that TEFCA has reached, I think it was 500 million records exchanged. It's no longer a pilot project. In the last year, we went from 10 million to 500 million records. What was the vibe on the ground? Is the hardest problem still trust, or have we moved into an area where scaling is the new target?
I can offer my thoughts. I guess I just want to say that I think it is exciting, and I want to congratulate everybody who's been involved in scaling it up. Like a 50-fold increase is impressive in a year. I also think that there's a lot of data that isn't being exchanged yet, and so there's still plenty of opportunity. In my experience, just talking day to day with clients, trust continues to be something that is a topic. I think we're going to continue to have to work through some of those trust-related matters, and that typically, this is encouraging. I don't want to sound discouraging when I say that. This is encouraging, but it also is not. We're not there yet, so I don't want us to declare victory until we've reached that level of exchange where I can connect as a provider to a QHIN, and I know the QHIN is able to connect to all the rest of the, I guess I'd say, users of the data that require access to it, and handle that for me, so that I don't have to have multiple different relationships that I'm using to share that data. That's the vision ultimately for TEFCA, is that it becomes this web of kind of centered around the QHINs of connectivity that allows you to share the data without having to manage all of the trust environments. All the trust relationships and all of the policies, et cetera. And I think that we're on our way. It's exciting, but I would say we're still in the early stages, and that people should continue to consider, how they can get involved, and how they can take advantage of it. Because as more are involved, we're going to get to the point where the network effects start to take effect, and you will really see people start to reduce the cost of compliance, reduce the cost of connecting from one, say from the state to a healthcare provider and vice versa. But um, I feel like it's too early to declare victory. I feel like what we're saying is we've stepped up a level. It's exciting. Let's continue to push forward. So that's my kind of takeaway.
I agree with you, Mike. I mean, I think trust is going to stay front and center for the foreseeable future, and I think that's probably good and healthy. I think even some of the recent sort of publicly reported episodes about kind of questions of trust in the network are healthy growing pains, in the sense that they're forcing all of the participants in the network and the folks that are governing it to really grapple with the practical limits of what the framework is intended to do. So those are uncomfortable conversations, and I think one of the things about a network of networks is that folks need to be able to trust sort of all 5 degrees of Kevin Bacon, and not just the immediate counterparty that's right in front of you, and that's something that's new for our industry and is going to take time, and I think should be handled with care. The other thing I would say is, the growth from a few million to 500 million transactions in a year is impressive. One of the questions I would have is, how many of those transactions are ones that would have occurred otherwise? It's just that they've moved to pipes that have been sort of blessed with TEFCA in terms of the data governance. My guess is that the easiest stuff is what's been lit up first. In other words, to do something more or less the same, but otherwise do it in a TEFCA-enabled way is relatively easy for certain kinds of data exchange. But there are all kinds of pockets of data exchange and interoperability that are harder, and where the trust issues are more daunting. And so, when we sit here next year, we might not go from 500 million to a billion or 2 billion. I don't know what the shape of that curve is going to be, but I think some of the harder yards that are really going to drive that value and efficiency that you're talking about are still in front of us.
And I think two things that people should be tracking, and that we're certainly tracking, that will help us to understand, how the value proposition is being realized. One is, there's a participation map that TEFCA provides. You can take a look at that and see, who's been onboarded, who's actually a part of the network. And then the other big one is going to be those use cases. Which use cases are now live? That's ultimately going to determine the value. And I do think, just given the reality of kind of local requirements or state level requirements, tribal requirements, that there is going to be a need to continue to work. As you were saying, David, I'm just reinforcing, I guess, foot stomping in a sense, that trust is not it's not going away, and those kinds of conversations will have to be had. I think that as that occurs over time, those things will become common and standard and well understood. And then it'll just be changes that need to be absorbed into the trust fabric. But at that point, we'll probably not be talking about TEFCA anymore, because we'll be talking about what's running on top of it.
Well, speaking of trust, another major theme this year was making America healthy again through technology. There was a heavy focus on behavioral health, and specifically the US CDI Plus behavioral health data set, and integrating behavioral health into physical health data or the rest of the health data set out there. What's the biggest technical hurdle to making mental health data just as liquid as a lab result?
It's a big question.
Well, one thing I would say is a lot of these providers were left behind 10 years ago in meaningful use. And so we talk about technical hurdles, but the investments that were made in other parts of health IT at that time that are really foundational to things we're talking about today, like TEFCA, have not been made in this cohort of providers. And so I think that's a huge hurdle that I hope the federal government will keep in mind as they look at their policy choices over the next year or two. I was really excited to hear the national coordinator shout out the BHIT initiative that we're involved with at ASTP and SAMHSA, which is it's significant. It's a $20 million contract with several pilot projects that are being run across the country to demonstrate advances in technology adoption by behavioral health and substance use treatment providers. It's a drop in the bucket in terms of probably the level of investment that's required across these folks generally, but I'm excited to have some case studies about what's possible with the right focus and attention and commitment from the government.
And I'm also encouraged by some of the pilots. I mean, it's clear that the federal government continues to be interested in how do we improve substance abuse and mental health. But I agree with what David said, like that lack of the same level of investment early on is now we're reaping, I guess, what we sowed at that point. And there is definitely a difference between the level of electronic data exchange for substance use and mental health as compared to just your regular healthcare, and I think that's going to continue into the future until there are some investments at different levels. And so one of the things that I also find encouraging is we have a client in Montana. Apparently, Montana is also looking at investing more into substance use and mental health services and has put a lot of energy in there. And so one level is what we're doing here. We're talking about ASTP, and I agree that we should continue to push for standards that support that. And ASTP is also pushing for those standards with things like the project that we're working on that David mentioned, and with things like US CDI Plus for behavioral health, and with the FIRE implementation guide around behavioral health that they're going to be that they're already actively piloting under that project that we're involved in. But states and regional coalitions can also do things to raise the level of capability that behavioral health providers and substance use agencies and providers have available to them. So I see this as it's interesting that they're pushing it. It's exciting they're pushing it. I'd like to see, like David said, the standards and the investment, not just standards, pushing supporting that as well.
Yeah, Mike, you mentioned Montana. I actually think that the rural health transformation grants that states have received, and particularly states where the sort of per capita economics of those grants is especially transformative. And Montana is a good example with a huge allocation and a small budget. The plans that I've seen from many states are dialed in on this issue, and I think are pretty clear-eyed about the types of investments that haven't been made and need to be made. So I'm optimistic that those grants could serve as a bridge into kind of a next phase of integration between behavioral health systems and the rest of healthcare. I'll add one caveat to all of that. As you guys know, we've got a significant presence in the state prescription drug monitoring market. And the PDMPs actually play by their own set of rules. And unfortunately, a lot of this data is especially walled off from kind of HIPAA covered clinical and care coordination transmissions of data. And that's, in some ways, accidents of history. So, a lot of the PDMP foundational work was funded by the Department of Justice, and states ended up hard coding a different set of standards into their state statutes and regulations. They also have state-specific rules that govern the exchange of PDMP data that differ and preempt HIPAA in certain ways. Like, for instance, in most states, you can't opt out of the sharing of your PDMP records. And so I think this has created some unfortunate and needless complexity when it comes to better integrating this really important data set into the rest of the clinical picture that providers have at the point of care. I hope this is something that ONC and some of the other HHS stakeholders take a greater interest in, but we'll see.
So, David, I think I've got time for one more question with you. What was the most interesting thing that you heard outside of an official session, whether that was at a networking event or even the bar at the Omni Shoreham?
It's funny. I mean, this is the kind of event where a lot of times it feels like all the action is happening in the hallways and the lobby of the hotel. Mike, I think over the course of 2 days, no matter what the session was, there wasn't a time where nearly all of the sofas and chairs in the lobby were full of people chit-chatting or gossiping or having business conversations. So that's where a lot of the fun and the action is. I don't know if there was one specific thing that stands out, but I will say, a year plus into this new administration, I think we've lived through a lot of uncertainty in terms of the regulatory environment and the funding environment, and some sort of shifting policy winds. I felt like there was a new breath of excitement and optimism in the crowd. There's more clarity now about what the sort of medium-term federal funding picture will look like, and I think it's become more clear what this administration's policy priorities are. We talked about a bunch of them here, and so I think people, like anything else, people crave some level of certainty and visibility, and I think Tom Keene did a great job articulating a clear vision for his priorities. And I think the secretary's team and other parts of HHS have done a better job of that too. And people are able to execute against that. So I applaud that. And I think the excitement about that was palpable in the hotel.
Yeah, I agree with that. I really don't have anything to add. I think there was a lot of good energy in the hallways, on the sofas, in the bar, at the tables where people were sitting and chatting with each other. And, it's exciting.
Well, David and Mike, I want to thank you both for taking a few minutes out of your day to share with us some insights from the floors of the ASTP conference last week. And, really appreciate you being here. This concludes another episode of the Next Orbit podcast. We'll see you on the next one.
The Next Orbit podcast requires more than a conversation. Be sure to subscribe, write a review, and share it with someone you think would benefit. Thanks for listening, and we'll see you on the next episode.